chronic joint pain can really put a damper on your day-to-day activities. Today, there are less invasive treatment options that can fix the problem in no time. Here to explain, please welcome back Dr. Stephen Brown with Park Plaza Hospital. All right, you know, part of the problem with medicine today is that it's come so far, but a lot of us saw parents and grandparents go through something, and we think that's the same thing. The technology today is so much different.
Absolutely. The technology has changed significantly over the last 10, 20, and even 30 years. The knee replacement technology we have today are not the same knees that your parents got 20, 30 years ago. And it's less invasive, quicker recovery times, and more beneficial to the patients.
Yeah. Okay, so let's get to the point where somebody starts having some knee pain. First, you have to assess why that pain is happening, right?
Exactly. There's several reasons somebody's knees will hurt. If you're 20 years old, if you sprain your knee on the football field, then you want to rest it, ice it, elevate it, and get back to playing. Later on in life, we start developing arthritic conditions. Our cartilage starts to wear out, the protective covering on the bone starts to fade away.
So literally you'll have bone rubbing against bone like that, right?
Absolutely. As time goes on, in certain people, a small percentage of the population, all the protective cartilage goes away, so it's bone on bone and very painful.
Yeah, and that's what we're looking at right here. Okay, so there are various ways to deal with knee pain before we get to the operation. Some of the things we might try is like activity modification.
Absolutely. A less impactful lifestyle. For example, cut out running. Do low-impact activities such as a bicycle or an elliptical or so. That is very good for you, but it's less harmful to the knee.
Right. Okay, well, you have to cut that out for me because I'm not doing it anyway. Riding the bicycle and all that type of stuff. All right, anti-inflammatory medication. So if it's the inflammation that's causing that pain, we can bring that inflammation down.
Exactly. Medications such as ibuprofen, Aleve, those are the first medical treatment options in terms of medications to help reduce your inflammation and pain, and they can be effective to a certain extent.
Yeah, and non-narcotic pain meds, because we know that's what got a lot of people in trouble before, is using narcotic pain medications. So joint injections, we're hearing a lot more about these injections that could help. So what's happening when we do those injections?
Injections are very beneficial for short-term relief. They don't reverse the processes that are taking place inside the knee, but they can help relieve the pain. And the various types of injections. There are the standard cortisone shots, which give you quick relief. And then there are the more longer-lasting shots, such as one called 11's, which is a lubricant you put inside the knee, which can be very beneficial to the knee, replenishing some of the natural fluids, reducing the pain.
Yeah, there's physical therapy, there's bracing, and then for a lot of people, they can do that for a while, but I think if you can get to, let's just end it all and make it like it was, that's when we get to surgery. So who qualifies for that surgery? What are you looking for to say, you know what, now we need to go into a knee replacement?
That's a very good question. A knee replacement is not for everybody. It's for the patient who is truly bone on bone or has some other rare condition. It's not for the 40-year-old whose knee just hurts because they've been playing football or so. It's for the patient who's bone on bone, who has failed all the conservative treatments such as the anti-inflammatory medications, the physical therapy, etc. Only then, and only when it is really affecting their active lifestyle, they can't do what they enjoy, they're dealing with the pain all the time, and they decide they're ready to have a knee replacement, is when it's time.
Yeah, and same with the hip replacement for that
Exactly.
matter.
Hip replacement's the same way, and shoulders.
Yeah, and we certainly know with all the studies that once somebody who's been active becomes sedentary, it's really kind of a downhill slope right there.
Absolutely. We want to keep people active. Very, very important. Active, healthy lifestyle.
Okay, so different types of knee replacements. There's a standard.
Right. There's a standard knee replacement, which is what the majority of people get. It's where we remove the bone completely from the end of the thigh bone and the top of the leg bone and replace it with metal and plastic components.
Yeah. This sounds like it's like completely painful stuff. I know my mom went through this, and she went through it. She's around 85, and she was up and at 'em. So again, how you do the surgery today, it's much different where people are up and walking around.
It's a bit different. This is an example of a model with a standard total knee replacement, which is a very effective operation. And you can see that the components are quite significant and a bit heavy.
Yeah.
And this is what we put in the patient's knee. And patients are typically in the hospital for a few days. Most people go home after 2 or 3 days, and they're up walking the day after surgery.
Wow. And there's a partial knee replacement. So again, that idea of we don't have to take care of everything if it's just one little area that's causing a problem.
Exactly. And several people, a good percentage of people actually, only one side of the knee is affected, as you can see on the picture up here. In that case, we only replace that one side of the knee as opposed to all 3 areas inside the knee.
Okay, and then there's the new ACL sparing knee replacement. What's different about this?
Right, a new technology has come out very recently, and it's just been approved by the FDA this past year. In a typical knee replacement, we actually cut the ligaments, as you see on the animation, both the ACL and the PCL, which are big major ligaments inside the knee. In this new knee replacement, we spare these ligaments, and we put the components around the ligaments, which give the patient a much more natural feeling knee.
Yeah.
Patients who have had the new ACL sparing knee on one knee, and they've had the other standard one on the opposite knee, notice a difference. The ACL sparing knee, they feel is much more of a natural feeling knee.
Because you're leaving more of the parts.
Exactly.
Yeah. Okay, exactly. And the other great thing about Park Plaza Hospital is that, especially if you're having knee problems, you can drive right up and you have valet parking. I know this because I've been there. You have valet parking. I love it. So you just drive right up there, and you're kind of on the edge of the medical center, so you don't have to go all the way in, and you just drive on up and get that valet parking there. Hey, for more information on Dr. Brown and Park Plaza Hospital, you can call 713-527-5000, 713-527-5000, or log on to parkplazahospital.com and get out of pain. Also, don't forget to log on to Facebook and let us know if you think the U.S. should have a nationwide junk food tax. Why or why not? We'll share some of your comments later on in the show.